Hello, my name is Cordelle. I'm a nurse educator student, and I'm going to be doing a cardiovascular exam. I just need consent in order to proceed. I'm going to actually be doing this with this wonderful young lady. She volunteered. I need consent from you to videotape this, also to make a link for YouTube as well
Yes,
to share with my professor. Do you give consent?
yes, I do.
Okay, thank you. So we're going to actually proceed. And what I want you to do for me is actually turn your neck to the left side. Okay. And what I'll be doing is actually observing her neck to see like the jugular vein, and also to see like the carotid artery to see if there's a like the beating on it. What this would show is actually if there was like distension or increased heart rate, it would actually palpate and you'll be able to visually see it. In this case, you don't see it because she is not with an increased heart rate. So currently I'm just going to actually palpate lightly. So I observe, and so you can turn to the other side, face the left. Okay. And I'm slightly palpating. Okay. Sorry, my hands are a little cold. So you could feel the carotid pulse. It's actually +2. It's equal in both ends bilaterally. I'm just going to also listen with the bell and also with the on both ends. Okay. So based on this, you are able to actually get and listen if there was any brewery or trills. In her case, it was you were able to hear the vascular. There was no brewery, but there was trills every time the aortic artery opened and closed. You were able to hear the fuse of blood perfusing on its way up to perfuse the brain. So, may I proceed? Okay, so what I'm going to do now is I am going to take a blood pressure visually. You would have taken a blood pressure to make sure that you'll be able to get a blood pressure. Our recent blood pressure was actually 120/65. It's easier to perform this exam on a male, however, I currently do not have that availability. But you would inspect the chest, and what you would be doing when you inspect the chest would be looking to see if there was any like lesions, if the cavity was symmetric or asymmetric, which in her case is actually symmetric and it's equal on each side. What I'm also going to turn around and do is I'm actually going to slightly feel for her markings with both second intercostal spaces to get what we would say our cardiac markings for your aortic, pulmonic, Irv's point, tricuspid, and your maximum point for your mitral valve. So I'm gonna now proceed, and may I? Okay, so it's gonna be slightly here, so we feel for the notch. All right. Okay, so on this side would be your aortic, your pulmonic. All right, and the third, fourth, it would be Irv's point. In her case, we're gonna go right under and to the fifth intercostal space, and you'll get your point of maximum thing, where apex of your heart. Okay, so I'm just going to slightly move down with that and be able to actually listen to see if there's any regurgitation or if there's any murmurs. And in somebody that has large breasts, not in her case, you would ask them to lift the breast so that you'll be able to actually get an apical pulse. Normally, getting an apical pulse would be for a full minute, and you would listen to the apex. In listening to their findings, no murmur present. S1 and S2, you can hear it at the closure together. There is no split S1 or S2. Heart rate is on average 65 based on my 15 minutes count, 15 seconds counting correction. Okay, so I'm gonna now move down to slightly palpate just above the abdomen, where we could actually look now for the split of the aorta, which then moves down to the celiac area, and then we would palpate her femoral. Okay, we will also be listening for any bruit or trills, and that would actually let us know if there is a possibility of an aneurysm or a dissection that might be there. So I'm literally going to actually look. This is her umbilicus, and slightly above the umbilicus is where we would proceed. And we'll be listening with the bell. And it's much easier if at this point you have the availability of a stretcher or bed to place your patient on, so you could actually palpate to feel if, in this case, the crest, okay, and then the femoral arteries, which you'll be able to actually palpate and at this point. So this would be the end of the cardiovascular part. We'll be moving to the peripheral vascular exam. In the peripheral vascular exam, I'm checking to see the warmth of her hands, which is very warm. I inspect it. There is slightly some warmness, vascular presence, vessels are present on both arms. I'll be actually, since I'm on this side starting, I would look for her radial pulse. Then I'll move up and I would be palpating her brachial at this point. Okay, and I'll be looking in her case at the tip of her nail and also here to actually look for a capri fill. It should be on average for the normal healthy adult 1 to 2 seconds. In some cases we accept 3 seconds. In her case it's actually 1 second. So I'm going to actually do the same thing, palpating here for your radial pulse. Okay, +2, bilateral, and let me check your brachial. Okay, +2, thank you. And I'll check your cap refill. And cap refill is 1 second. Okay, so what I would do now is actually make sure, can I look at your legs? Okay, and I know it's cold currently, so I'll be looking at the legs. I'll be feeling for warmth. There's hair present on this leg, and there's also hair present. The reason why you look for hair is to see if there's any peripheral vascular compromise. In this case, there's perfusion and it's compromised. Her skin is warm to the touch, just as the upper extremity. I'm going to slightly look at your toes, okay, because I also want to do the cap refill, which is grade 2. Okay, 1 second. I'm just going to also palpate the dorsalis pedis pulse. Okay, tibial pulse, and slightly relax your leg a little bit. Okay, and I'm palpating the popliteal pulse. Okay, which is a little, okay, present. Good. And you want to look and see if there's any hair on the toe because of the same concern for vascular compromise. In this case, it's not currently present. Thank you. I'm going to do the same on this side. Okay, and then warm, there's hair present, cap refill. Okay, 1 second. Okay, dorsalis pedis. Okay, present. Good. And just relax your leg slightly. Okay. Okay, +2 bilaterally on all pulse sites. Okay, and this concludes our peripheral vascular and cardiac exam. Thank you guys. Thank you, ma'am. Have a good day.
You too.